had access to more information than many people did because I was vice chair of the Health and Human Services Committee in the Senate. And so I was aware of much of what was going on. And then in the early days of April of 2020, when I received an email from the Department of Health with a link to the CDC advising me as a physician that they were going to adjust the way death certificates were completed, skeptically at that. And I said, what's going on here? And without meaning to be any kind of grand whistleblower, I ended up making comment about this on a local TV program that I'd been on the news for. And that traveled quickly.
What did adjust death certificates mean?
Basically, in the Minnesota Department of Health communication to the physicians, they said, if you believe that COVID-19 may have contributed to the cause of death, you can go ahead and put it down as the cause of death. And that's not right. The CDC for decades has said that our job as physicians when we complete a death certificate is to try to identify the initiating event that started the process of demise for the patient. So, for example, if I have a heart attack tomorrow and a month later I have congestive heart failure and we find that the heart attack was so substantial that I've lost the ability to effectively pump blood, and we learn that I'm not a candidate for transplant and there's no remedies for my situation, and over time I falter and become more and more frail, and perhaps I go on hospice knowing that I have end-stage heart disease. If on my last 48 hours of life on Earth, I get exposed to COVID-19 without ever being tested or even having any symptoms of it, when I died of a heart attack. The underlying cause of death would be coronary artery disease, and that led to a heart attack, which led to congestive heart failure. But it should not say that COVID-19 was the cause of my death. We were being encouraged to go ahead, and they said in this document, if you think that COVID-19 was a contributing condition, you can put it down as the cause of death. And I said, no, there's a box 2 on a death certificate called contributing conditions. That's where you put contributing conditions. If it's emphysema, if it's asthma, influenza, we put it in the contributing conditions box. We were being told with this disease, we could put it as a cause of death. I raised a ruckus and said, this isn't right. I did not get any response from the Department of Health. Instead, I was asked to be on numerous national TV programs. I was asked to be on the Ingram Angle, and subsequently Rush Limbaugh came to my defense, and we had Tucker Carlson show on inviting me. But the bottom line is, this was April of 2020. And in June of 2020, I received a letter with red letters stamped confidential from the Board of Medical Practice advising me that for the first time in my career, my license was under investigation.
You know what, guys, man, I wanted to do a video on this because, a couple weeks ago, my father passed away. And he had numerous medical conditions that were going on. And it's something that really did not surprise us. But about a month and a half ago, my father was sent home. And they admitted him to the hospital because of the conditions that he had. And he was in the hospital for about 2 weeks, thereabouts, roughly. And then they sent him to a nursing home. And then he was in the nursing home for about 10 days or, whatever. And then they sent him back to the hospital. Well, while he was at the hospital the second time, he contacted COVID. And he never really got too sick. He had sneezing and watery eyes and runny nose, that kind of stuff. But never anything bad. Never any breathing problems. He was never on a ventilator, nothing like that. And so, again, he was never really, really sick. And they put him in quarantine. And maybe, I forgot what it was, a week, 5 days, whatever it was later, they took him out of quarantine. And he was fine, or seemed to be fine. Again, there was never any problem breathing, nothing like that. And due to the other conditions that, again, did not surprise us, they said, a couple days before he passed, we're going to put him in hospice. Because, again, there are a lot of conditions going on here, not to do with COVID. So they end up sticking him in hospice. And he passed away like 24 to 36 hours later, or less. And which, again, we were not surprised. But my father did not die of COVID. There was no issue with breathing, no nothing. At that point, he wasn't even sneezing at that point. There was nothing wrong as far as that goes. So I don't even know if I would call it a contributing factor to his death. But to say that, that's the actual cause of his death, no, that's a big stretch. A big stretch. So, there was nothing going on. There nothing at all. So, again, man, I'm not going to talk too much more on this because YouTube, they don't like that kind of stuff. But the fact of the matter is, man, they do have COVID listed down as the cause of death on my father's death certificate. They have it listed. It did not cause his death. I don't even think it was a contributing factor to his death. But again, that would make somewhat more sense to put that down. But as a cause of death, again, I'm not going to get into his medical history. I'm not going to get into that at all. But no, that was not the cause of death. Not even close. So again, man, we got to be careful. We got to wonder what is happening. We got to wonder how many of these numbers, how many of these deaths are being propped up, and how much of these numbers are being embellished. Again, we're 3 years out from the pandemic, or the beginning of it, anyways. We're 3 years out, and if they're saying that people like my father passed away from COVID, and he did not. Even 5-10% of cases are due to what they did to him, what they said with his. Then these numbers, man, they don't reflect the mortality of this disease, not at all. And so you got to wonder just how many cases are being propped up that aren't real. So again, I'm not gonna say too much more, but all I'm doing is YouTube. All I'm doing is commenting to what they said, and I can prove my father's death certificate, and I can prove that, and I also have witnesses telling, hey, no, there was nothing going on. So again, I can prove that, yeah. That wasn't happening. That wasn't going on. So again, we got to be honest, man. How many of these numbers are real, and how many are fake? We got to ask that. But hey, guys, if you would, please like, subscribe, and leave a comment down below. Thanks.
You son of a.